right at your mouth. So thank you, Peter. So welcome to the Solo Ager Network event. This is, I think, 8th in the series that we've had. So I know I see some familiar faces here, and welcome back. And are there people here for the very first time? We have a couple people. Terrific. Well, glad you're here. You came to a great talk, but then again, I say that about all the talks. So, but this one really, they all are. So I'm going to start with just some brief introductions with the Solo Ager Planning Committee, which is comprised of myself, Thea Curtin, and Terry Fuller. Where's Terry? Terry, right there. Suzanne Norton, who's a social worker here at the Jenks, and again, myself. So, okay, we can advance the slide. So, who is a solo ager? Present are kind of meet the unique needs of solo agers. They are very, very often meet the needs of all older adults. So everybody is welcome. Okay, next slide. So what is the Solo Ager Network? What are we here? It's programs to educate, empower, and encourage older adults to create a care plan, know about the services and support that are available before you need them. And we learn from industry experts. We have one here today with us, Rihanna, who I'll introduce in a minute. And we also learn with and from each other. And the important part is to know what services and support are available before you need them, because when you're in a situation or an event or something is happening, you don't always have the time, the energy, or the capacity to be able to figure out what's out there and how to connect with it. It's also important to know in advance, because you get to decide what you want. And I don't know about you, but I'm pretty independent. I know what I want, and I want what I want. So I get to decide, you get to decide, and your wishes are known by the people who are supporting you, and they can be honored. And a common concern that we hear from a lot of older adults and a lot of solo agers is, I just don't want to be a burden to someone. And having a plan creates peace of mind for yourself and others. Okay. So these are all sort of these are the general categories of what you would call a care plan. It's like what services and support are in each of these domains, so to speak. Today, we are in the domain of essentially aging at home and also health management as well. And we probably cross over because care managers is they provide a lot of different kinds of things, but those are the primary two categories. And I also just want to mention on your seat, there is a half-page sheet. It's called Solo Ager Network, Upcoming and Past Programs. So you take a look and see what's coming up. And brand new, the last bullet on that page is that the Jenks generously is hosting a Solo Ager Past Events webpage with all the programs, the descriptions, contact of the speakers, websites, and if there's links to WinCam recordings, that's on there as well. So yeah, I thank you. Thank you. We thought it was awesome too. And actually we can really primarily thank Peter for the catalyst to get it going. So thank you, Peter. It takes a village. All right. Who do you call when you are in a situation and you need something? So what you can do is contact either one of the speakers that has spoken at the Solo Ager event who has particular expertise in that area. You can call the social worker at your local senior center. If you live here in Winchester, social worker is Suzanne Norton. You can contact Suzanne. And also just want to mention that Minuteman Senior Services is also an agency that has a breadth and depth of services, and they have an information and referral department. You can always call them too. They're a great community resource. Upcoming programs, you'll see this in your half sheet, but I do want to just mention that May, drive safe, drive safer, drive longer. Driving is so important, and I think I will say in particular for solo agers who don't have children, close family, friends to maybe be able to drive them, driving becomes a really important skill to be able to maintain your safe driving and to know also what other transportation possibilities are available. So that's in May. Please come Wednesday, May 28th. In the fall, we're doing a life transition binder, which is it's a compilation of all the support and services that that are available, but more importantly, it is your health information, it's your financial information, it's your legal information, it's documenting everything that someone would need if they needed to step in a situation to help you and support you. So it's a great program, and then we'll be doing a full week class with that as well and creating that together, facilitated by a fantastic leader. Friday, May 2nd, right around the corner, 2 days away, we're having here at the Jenks, Aging Symposium, Artificial Intelligence and Healthy Aging. Please come. It's at 9 o'clock, starts at 9. I think lunch will be provided. And just, but go to the website and register, because registration is required and the number of people is capped. And then coming soon, there's an age-friendly Winchester survey that's coming out. We'll be promoting that soon. Please pay attention when you see that. Respond to it. Takes you about maybe 10 minutes to complete it. Extraordinary helpful information for us to get feedback from you as to what's working, what's not in Winchester, and we'll be following up with that with customer focus groups and all sorts of other things, but this is the first step. And we want to make sure that, I want to make sure solo agers' voices are heard. So all ages, yes. Yes, it'll be available online. It'll be a link online. It'll be available Friday. Friday, the survey goes live. Yes, you can fill it out online. It's just like click boxes, it's easy. Not a lot of writing, just click boxes. Okay, next. Today's agenda, just about to be done here with the Solo Ager Network introduction. And then we have care management for aging with support and advocacy. If you want to take notes, by the way, all the information that is on this slide is on the full page handout that's on your sheet. So everything that I've just presented is available, is on a full page sheet on your chair. If you want to just take notes, you can turn that over and take notes on the back of that. WinCam is recording this. They will not be recording people in the audience. They will not be recording the Q&A afterwards, but there will be a link onto their website which will be available. And that'll be on that Solo Ager past events website, which you have on your half-page sheet. And you can ask me if you have any questions on that. Then we're going to do like some Q&A, and then we're going to take a little stretch break and come back together to have a conversation amongst ourselves, because this is a community where we also learn from and with each other as in addition to the experts. Okay. And last but not least, please silence your cell phones or anything else that beeps. Bathrooms are out this door where you came in and to the left. Place your feedback forms in the basket that's on the table right on as you go out the door. We really do listen to and read your feedback, and we have shaped this program according to feedback. So thank you in advance for doing that. And finally, today we have Rhiannon Stair. She is the owner of Riverside Care Advisors, which is a care management company. And just want to say, in essence, care managers have an in-depth knowledge about what services and support are available, and they partner with you and anybody who's involved with caring for you. They partner with you to advocate on your behalf and ensure your wishes are honored. I think of it as care managers are sort of like the primary care physicians coordinate all the specialty services and testing, all your medical care. They coordinate all the medical care. Care managers coordinate all the support and services to help support you living at home in the community, as well as navigating the healthcare system. So that's my intro, and I'm going to hand it over to Rhiannon. Thank you so much.
Thank you, Marianne. Oh, let's see. Can you hear me? All right, let me position this better so it's. Okay, can everyone hear me? Okay, great. So thank you for that lovely introduction, Marianne, and thank you all for being here on this beautiful spring day. And I am so excited to hear that the Winchester Senior Center has this Solo Agers networking group. I think it's fabulous, and I'm hoping that more communities will also do the same, because I think it's really needed. So again, my name is Rhiannon. I am a nurse and have been working as a care manager for the last 7 years or so. I'm the owner of Riverside Care Advisors. Our office is based in Newburyport, Massachusetts, but we cover about a 45-minute radius from here, and we help support aging adults, solo agers, also advanced planning or proactive planning as well. So I'm going to talk a little bit about what it is care management is, and then obviously if you have questions at the end, I'm happy to answer any of those, okay? All right, so solo aging is an increasingly common reality, and many individuals may not really have a spouse, children, or maybe if you have children, they may be at a distance. So you may not have anybody local to support you when something comes up, if a crisis hits, or you just need that extra support, advocacy, or professional guidance. And that's really where a care manager can help. So, and aging on your own really brings unique challenges. Questions like, who will advocate for you if you can't yourself, right? How will decisions be made if you're unable to make them yourself? What supports should you put in place ahead of time? So thinking about all these questions, and I'm sure that's why you're all here, right? So that's where planning becomes really essential, and where an aging life care manager can help guide the way, and we can really help play a crucial role in that. Like I said, as for me, I'm a registered nurse and a certified care manager with a passion for helping older adults and really helping make sure that they can live their life with dignity, respect, and a good quality of life. Really, I think that's my main goal when I'm working with individuals. At Riverside Care Advisors, my team and I specialize in solo aging care management. We do also work with a lot of other individuals, but we've been seeing a lot more solo agers recently, and it certainly is a growing population. So today I'll really guide you through what care management looks like, how it works, and how we're able to support aging individuals, and what steps you can take to really create your own plan for the future. So think of us really as professional advocates, navigators, and planners. The healthcare system, as you know, is very complicated. Sadly, oftentimes our doctors, our primary care physicians, specialists don't have the time to sit with us and really have conversations and get to know us well enough. If you have a great primary care provider, I think that's great, and maybe they're able to do that for you, but oftentimes that isn't the case these days. So we really help to assess needs. We create care plans. We coordinate services and advocate across the healthcare system. We're looking at, just like Mary Ann had said, we're looking at housing, legal, financial, also social, and making those connections as well. And really just helping meet individuals where they are, and especially during life circumstances and challenges that come up. And so really for solo agers, we often become a trusted point of continuity and someone who knows your history, knows what your wishes are, and then also ensuring that your voice is heard in decision-making processes. So in those moments, if you're not able to make your own decisions, engaging with the care manager or professional, that's part of what we do, making sure that we really get to know who you are, making sure we're having all those discussions so that we can make sure that your wishes are followed through when the time comes. Who pays for care management? So unfortunately, care management is not covered by insurance like Medicare or different Advantage plans. The one insurance that does pay for care management is long-term care insurance. So if anybody has long-term care insurance, depends on your policy itself, but sometimes there is a part of the benefit, it's usually named care coordination. So sometimes that is a piece and we're able to help tap into that so that you're able to get that benefit. That's also something we do as care managers, and something we often do is help people unlock their long-term care insurance policies when it's time and when when you qualify to start tapping into that benefit, because that can be a whole nother very complicated process. The cost range in Massachusetts is anywhere from $150 to $200 an hour, and really you have to think of it as an investment. There are a lot of decisions that you need to make as you age, and we can help make that process not only less stressful, but we know what the resources, that are available, and we can help make recommendations on those resources based upon our experiences with utilizing them with other clients. So we make those referrals based on experience utilizing them, not because we get referral fees or commissions or anything like that. It is solely based upon our experience utilizing them. And what I often see is sometimes, unfortunately, if people don't engage in our services soon enough, there can be sometimes costly mistakes made that we have to, at the time when we're engaged, and we have to jump in and have to make changes. Because maybe you chose the wrong assisted living facility, or maybe home care services or whatnot. And if you're planning those things in advance and reaching out to a professional like a care manager, we're able to kind of help guide you on those recommendations. So personal consultation we provide, basically what that is, so these are just different options. And oftentimes solo agers kind of initially come to us, and I usually recommend a consultation first, because that way it's a good way to get to know one another. We're able to kind of collect, social, medical, financial, as well as legal information, and kind of what it is that you already have done. And then I can take a look at that, or we can take a look at that and help make recommendations accordingly, and also discuss with you during that consultation, what are your wishes? So, and what is your situation? And we can have a conversation about that, and I can help guide on what recommendations, both short term, so maybe you have no issues right now, no medical issues going on, and everything's fine, but you really are just looking to engage a care manager for planning purposes, so that when the time comes, you need somebody. And so we're able to just have that discussion about what it is that we can help you with. Sometimes people have also a hard time if you're a solo ager and you maybe have a healthcare proxy, but that person is maybe a friend or a distant relative, or maybe you're having a hard time choosing a healthcare proxy. This recently happened with a solo ager that came into our office a couple of weeks ago, and she was just having a really hard time asking an individual to do that on her behalf. But part of what we do is we can partner with your healthcare proxy, and we can let them know that, we're a professional that's engaged. We know the landscape, we know the resources, so we can help along the way if something were to happen, and we can be the boots on the ground. So like if you have a distant relative that's your healthcare proxy and they live in Santa Fe, New Mexico, and something happens and you have a care manager here, for some reason a crisis happens and you end up in the hospital, we're able to jump in and help to advocate right away for you and work together with your healthcare proxy on those decisions. So it can be very helpful. So during that consultation, like I said, we gather that information, we provide recommendations and really identify any needs and what your goals are. And then we're able to help summarize that back to you in a written plan as well. And then just looking at both long-term strategies, resources, and then just guidances on next steps. So we also provide comprehensive care management services. We're able to kind of take a holistic picture and looking at everything that's entailed. So maybe you decide to have a consultation now, and you have that information, you have that care plan that's in place, but you've decided you really want to engage in services so that if something does happen, we're basically in the waiting on call, and we're able to jump in and help you navigate the healthcare system. Maybe you need assistance with navigating an upcoming surgery, or maybe you have a complicated chronic condition, and we're really able to help guide you on medical decisions, help to sometimes even make recommendations for particular physicians or specialists. We can help communicate with physicians as well on your behalf, and really help to take a look at managing your kind of whole medical plan. We do also help to transport and attend medical appointments if that's needed. So we can be that person, that sounding board during the medical appointments, and then be able to kind of help you through, just making sure that you're understanding the information that's relayed during the appointment, but not only that, making sure we're making a plan before the doctor's appointment to say, okay, these are the important points we want to bring up during this appointment, and making sure that those questions are addressed. We also kind of take a look at housing and aging in place. Most people, their wishes are to age in place, and so we're there to help do that for you and make that happen if it's at all possible. Helping to make recommendations for safety, setting up the home in a way, maybe you need modifications. We're able to take a look at the home and make recommendations for that. We also have professional resources that we recommend to have them come in and help set things up, like if you need a ramp, or maybe you need a lift on a stair lift, or anything like that. Or if, there are all sorts of things that can be put in place to make it a safer place for you to stay for the long term. We're also able to help make recommendations for home care services. So maybe you're starting to need more and more assistance with activities of daily living, or like, getting dressed or showered, or maybe it's temporary. Maybe you're anticipating an upcoming surgery, and the anticipation of that surgery, or that you're going to need a little assistance prior or after the surgery, and so that we can make sure things are set up for you so that you can be well supported at home while you recover. There are some situations where, and it really depends also on your wishes, and each individual is different, whether or not you want to stay in place at home, or some people want to look into independent living facilities or continuing retirement communities, assisted livings, memory care is sometimes needed because of cognitive issues or a dementia diagnosis. We know all of those. We know all of those places very well, and can help make those recommendations for you. And they're all a little bit different, and and also knowing the current situation in each individual place as well is important, because one place may look very nice but they don't have good care, and another place may not look so nice but they have excellent care. And so that matters a lot, and because you don't want to move into a place because you need assistance and then the assistance isn't there for you. So we will help make those recommendations for you, and even help if you've decided you want to make the move and you're moving from home. We also know resources to help you with that too, with the whole, because that can be completely overwhelming if you're needing to move and downsize and those types of things. So we touched a little bit on that, but just making sure we also are very familiar with the different resources, referrals. We always make sure that if you don't already have an elder law attorney, or you don't have your any of your advanced directives in place already, we're making referrals to elder law attorneys, or providing you with names of local elder law attorneys to get in touch with, financial planners, money managers. Money managers can also be very helpful if managing your bills and all of that, and they're wonderful resources as well, and can help come into your home and meet with you on a very specific time frame basis to help you manage all those things if it's becoming overwhelming. We talked a little bit about advanced directives. We're really making sure that's part, for me, I'm always making sure that all of our clients have these things in place, because it is so important. If you don't have, if you don't have a healthcare proxy or a power of attorney in place, or maybe if something changes, you need to make sure you're updating the plan, because things change. Maybe you don't own the same home you did. So I say at least every 5 years, taking a look at that and meeting with your elder law attorney, if you have one already, to make sure that the plan that's in place is what you still want, that it still makes sense. Also, does anybody know, or does everybody here know, most people don't know what this is, what a MOLST form is? Yeah. So a MOLST form they're medical orders for life-sustaining treatment. Generally speaking, this is done, maybe later, or if you have some kind of a chronic diagnosis. It's very specific. It's not, so part of it is the DNR, so do not resuscitate. So if you don't want to be resuscitated, you will check that off, but it goes into a lot more detail about what your wishes are. Do you want IV fluids? Do you want, if something happened, like you had a stroke, would you want, to have a feeding tube if you needed it? Do you want to be intubated if you needed to? So thinking about all these things, a physician needs, because it's technically medical orders, a physician needs to sign it. And then, so you fill it out, you sign it, your physician signs it. And this can be, and what I always recommend is that you talk to your primary care physician about it and tell them you would like to have one filled out. And then it usually comes in a bright pink form. And once you have it filled out, you post it somewhere very obvious in your home. So it could be your front door or refrigerator. So that way, if 911 has to be called and the paramedics come and if you do not want to be resuscitated, that form is there and they're going to be looking for it. Because what happens a lot of times is maybe you're a DNR, but that paper is somewhere in your files and nobody knows about it and no one knows what your wishes are. And so what will happen is if you need to be resuscitated, they're going to resuscitate you. And even if a friend or a neighbor is there saying, oh no, I know they're a DNR, don't do it, it doesn't matter because they need to have the formal paperwork, so they won't do it. So, and I have seen circumstances where unfortunately that happens, and it's not a good situation, especially if that's not what the person wanted. So, very important. So you ask your primary care. Yep. So at your next primary care physician appointment, you can ask for a MOLST form, and they should provide it to you. So the comprehensive care management services, so we're really providing a lot of education and advocacy, coaching for our clients and anyone else that is involved in your care. We're involving them. It's a collaboration. Anybody else that's involved, we're in communication with, and which is important. Also making sure you understand your medical insurance and the benefits. So there is a lot to unpack in that, and a lot of people don't understand, for example, that, and some people are more and more educated, but if you go to the hospital and you feel like you're going to need some rehab or some help afterwards, that you feel like you can't just go right home with no help. But if you feel like you want to go to a rehab facility to get stronger, in order for your insurance to cover that, you have to have a 3-night stay in a hospital before your insurance will cover rehab. It's just a rule. And the way the hospitals are now, sometimes you're not officially admitted. You're like in a holding status, or what do they call it? Observation, like you're in an observation status. And a lot of times the hospitals don't want to officially admit you unless they absolutely have to. So that's just something to think about. And also another piece of information or advice I would say is a lot of people, once you're, I don't know, hit the age of 60, 65, I would strongly consider 65 and over, I would strongly consider having just straight Medicare, not an Advantage plan, because you're paying extra money for the Advantage plan, and what ends up happening is that, unfortunately, a lot of the resources, so rehabs, home care, like home health services like the VNA, visiting nurses, and in other kind of specialty services, they don't tend to take all the Advantage plans. So like, let's say you have a Tufts Advantage plan, and now your choices are narrowed at what rehab you can go to because only certain rehabs accept that insurance. So it's something to consider, and everywhere accepts Medicare, and they reimburse better. That's the bottom line, is that they're better at reimbursing than the Advantage plans. And so that's why a lot of the other resources don't take the Advantage plans, is because they're not getting paid, or they're not getting paid the amount they want for the service. So it's just something to think about. So also ongoing advocacy, helping clients navigate the healthcare system. We already talked about ensuring long-term care needs are met. So, it's a continuous conversation. As your aging, circumstances change. Not every care management practice has life enrichment. That is an additional service we provide. We have 3 life enrichment specialists. They provide basically enhanced emotional well-being through engagement, cognitive stimulation, social engagement. It's basically very high-level companion, as opposed to like a caregiver. It's high-level companionship, because it's been proven that social engagement, I think the fact that you're all here and you're part of the senior center, you're doing all that right. There is a lot of evidence, scientific evidence, that shows if you stay socially engaged and connected with other people, that you have better health outcomes. So I think, bravo to all of you for being here and being part of the senior center. I think that's great. A lot of individuals, though, for many different reasons, become very isolated in their homes, and maybe they're not able to drive anymore. Maybe they have a diagnosis that they're just not able to get out and about much anymore. They don't know many people, or, have a community that can help, engage them. And so that's where our life enrichment services comes into play and can be very helpful in engaging and really getting to know the individual, finding out what it is that they really like to do, and being able to re-engage them in doing those types of things that provide them enjoyment. I also provide plant-based medicine consultations. I am a cannabis health coach and have training on this as well. And this is also especially for people that want to look more into alternative approaches to traditional medications. Cannabis can be a very good option for many people, especially with helping with sleep, anxiety, also in mood. So I do education. I do 1-hour consultations. Yep. No, Medicare doesn't cover that. No. Although, you know what? I have heard that some of the healthcare spending accounts are starting to reimburse for CBD. So that's, I don't know, we're making some progress there. But I do virtual consultations. It's a 1-hour long consultation. I take your history, look at your medications, and then can help provide education on cannabis and how it works in the body, as well as just specific products and guidance on how to utilize that, and then also helping to communicate with your physician about what we're doing. Yep. Mm-hmm. Well, there are a lot of different products. There are a lot of different cannabis products. Oh, but yes. So cannabis, and also I work a little bit with, we do aromatherapy and functional mushrooms as well. So just as it's an alternative option, and I just like to share that with everybody. I actually do a separate talk about it. So, sure. So just if you are interested in talking more one-on-one, we do provide a 20-minute free discovery call and have a conversation. Just like to hear a little bit about kind of what your situation is, and then we can have a conversation about how Riverside Care Advisors might be able to help you, with all the different services that we have. And I always just really encourage everybody to be proactive in planning, so that way, because waiting for the crisis to happen is not good. I will tell you, because we've helped a lot of families in crisis, and it can be really difficult on many different levels. And this is just my contact information. I did leave brochures up at the front as well.